Meningioma has some imaging features that can be mimicked by other lesions. These features collectively are hyperdensity in CT brain, calcification, bone reaction including resorption and hyperostosis, enhancement, dural tail, and common locations that can be shared between meningioma and those other lesions. Today we are going to speak about the hyperdensity in CT brain. These are the common lesions we see in practice that are mostly hyperdense in CT brain. Number one, ependymoma. Number two, lymphoma. Also, some cases of schwannoma, also metastasis, thrombosed aneurysms, and a gliotic tumor called the pleomorphic xanthostrocytoma. We will take every one of each and speak about it separately. Ependymoma. The commonest location of ependymoma is the fourth ventricle, especially the lateral recess of the fourth ventricle, and it has three characteristic features. Number one, the solid component. Number two, the cystic component. Number three, the coarse calcifications of the tumor. And these three components can differentiate ependymoma easily from any other lesion in CT brain. Number two, lymphoma, and it is of two types, primary type and secondary type. The primary type commonly is periventricular, especially along the genu and the splenium of corpus callosum, while the second type is commonly leptomeningeal in distribution. The primary type is mostly associated with HIV and Epstein-Barr virus, while the secondary type is a spread. The mechanism of how lymphoma develop in organs that lack lymphatics still unclear, but the diagnosis of lymphoma is very important because the results of surgery are unfavorable. While the results of steroids, chemotherapy, and radiotherapy are better, surgery is better carried out to get a biopsy for confirmation only. In this example of CT brain, you see the lymphoma, including the genu of corpus callosum, bilaterally. So, this is the post-management CT brain follow-up, showing nearly disappearance of the lesion completely after radiochemotherapy and steroid therapy. The third lesion is schwannoma. The density of schwannoma in CT brain is variable, and in most cases it is isodense and hard to be seen. But some cases of schwannoma are hyperdense and can mimic meningioma. But in MRI, it has its characteristics. For example, the ice cream cone appearance of the vestibular schwannoma and the dumbbell appearance of the trigeminal schwannoma. The fourth region is metastasis. The metastasis, especially of melanoma, is hyperdense. Most commonly, it lodges between the gray and white matter after exiting capillaries, and this makes it hyperdense and can mimic meningioma if located in the same site of meningioma. Also, the thrombosed giant aneurysms, which are commonly arise from the middle cerebral artery, can mimic meningioma, especially when thrombosed and calcified and surrounded by significant brain edema. Gliomas are generally easy to differentiate from meningiomas unless they are well defined, limited to one or two gyri, superficially located, and show homogeneous enhancement. These features may collectively be seen in pleomorphic xanthostrocytoma, and this can make this lesion mimic meningioma, especially if located in the same sites of meningioma. In the next video, we will speak about the second feature, which is calcification in the CT brain.